Hi, my name is Dr. Edward Dourron, and I'm a reproductive endocrinologist. So that's a fertility specialist that focuses on helping women achieve pregnancies. So at Pathways Fertility, we are a different practice compared to most fertility practices. So I'm the only physician here. I see every patient. I perform every ultrasound, I do all the egg retrievals and all the embryo transfers. So working with myself for the entire treatment is something that's a big benefit for patients and continuity of care. The other thing we do is we don't use birth control pills or any medication to regulate your cycle. It's what's best for your egg and for your IVF cycle. It's not great for our schedule because it means that we work a lot of Saturdays, but we do it because it's what's best for the patient. So we're always going to put the patient first and do everything we can to make the patient have a successful experience. We started off with natural cycle IVF. Then we started using high-dose injectable fertility medications because the success rates were low and our laboratory techniques were not yet perfected. We just thought more is better. More eggs is not better. And oftentimes the egg quality suffers when you create 20 or 30 eggs. So what we do is we start off with an oral medication. It makes your brain think that your estrogen level's low so that your brain internally recruits more eggs. And I think that recruitment of the eggs in a more natural way is what is responsible for our heightened egg quality that we get with minimal stimulation IVF. In order to sustain the growth of those eggs, then we use a low dose of injectable medication. Typically, when you do conventional IVF, you're going to use anywhere from 450 units to 600 units of the injectable medication. When we do minimal stimulation IVF, our standard dose is 150 units of the medication. And what we've seen is that the egg and embryo quality is better in patients that do minimal stimulation IVF. The collateral benefit for the patient is that they're using a lot less medication, they have fewer injections, fewer side effects, and it ends up costing about half as much to do minimal stimulation IVF compared to conventional IVF. It's much easier on the patient, it costs less money, and I let the success rates speak for themselves.